guys, welcome back to Adulting Avenue with Reholile. If this is your first time on my channel, I am Reholile and this is Adulting Avenue. Thank you so much to my 225 subscribers as I filmed this video. Thank you guys so much for subscribing. Thank you for joining my channel and being a part of my community. So in this video, I speak to 4 people, 1 a medical doctor and 3 medical students. I ask them important questions about their journey with medicine. It's a very informative video for anyone who's considering being a doctor, anyone who hasn't gotten into medical school. One of my guests has a very inspirational and motivational story as to how she ended up becoming a doctor when she didn't initially get accepted into medical school. So this video is very informative. Please share this video with people who are applying to medicine, especially people who are still in high school, so that they know that just because you didn't get in when you first applied, it doesn't mean that you should give up, and which degrees are close to medicine and will allow you to eventually get into medical school if your wish and your dream is to become a doctor. So please enjoy this next part of this video. This is just a short video on things you should know about studying a Bachelor of Medicine and Bachelor of Surgery degree in South Africa. Firstly, this is a 6-year degree and it is full-time, and the following slides will tell you more about which universities you can study at and what are the cost estimates. These are values that I got from the university's websites, so please visit these universities for more information. These are the costs at the University of Cape Town. This is the cost at the University of the Witwatersrand. This is the cost at Stellenbosch University. This is the costs at the University of Pretoria. There are no fees available at the Walter Sisulu University. This is the average at the UKZN. This is the average at the University of the Free State. And these are the amounts at Sefako Makgatho University. So what subjects do you need to pass to be a medical doctor? You need to pass your physical science, mathematics, and life science. Grades are split into 3 categories at most universities. Non-academic performance includes leadership, sport, and things like being a part of the debate team. Applications at all of these universities are currently open. Please note that applications are open for a period of 3 months for this particular degree, so make sure that you apply as early as possible. If applications open in April, they will close end of June, and if they open in May, they will close end of July. On the other side of this video are the interviews with my 4 guests. Please enjoy, and please make sure that you are subscribed to my channel. A big thank you to my guests, Dr. Thobejane, Aneme, Zwakele, and Khotsofalang, for agreeing and accepting my invitations to be a part of this video. It means so much to me, and I'm sure it will impact other people who will watch this video. Thank you guys so much. This is Dr. Torijane's medical school story. She didn't get into medical school straight from high school, and her story is very inspirational.
My story is quite interesting in the sense that I never got any distinctions in matric, and yet I'm still a doctor that ended up getting into medical school. And that's just a little bit of a twist to inspire those who didn't really have good matric results or good grade 11 results, but still want to do medicine. It's not impossible. It just takes a bit longer. So I got rejected to get into medicine about 6 times before I got in, simply because my matric results were not good enough. Yeah, from matric, I got rejected to study medicine. So then the question was, what do I do next? So I applied for a BSc in medical sciences. It's the closest thing to medicine, but not medicine. It's like you're studying medical things, but you're not going to be a doctor at the end of it. So I went into that. It's a 3-year degree. And after every year of the degree, I would apply again and again and again, and kept on getting rejected. And one day I just decided to go to medical campus myself and ask the admin person that's in charge of medical school, like, what do you want from me? What do I need to get in? Then she told me, just try and get your grades higher. You need to get above 75% average in your BSc, and then we will consider accepting you. So I took that time and put that effort into that year, and I ended up getting in. And that's how I did it. Yeah.
Is medicine a challenging degree?
Well, I think that with every degree, you will experience some level of difficulty. But speaking in terms of medicine specifically, I think that one of the things that makes it difficult is having that transition between high school to varsity. The amount of work that you're expected to cover in a short space of time when you are in varsity is greatly increased from the workload that you cover when you're in high school. So I think that the workload definitely has an impact in terms of making the degree difficult, and you need to find a study method that helps you to be able to retain a large amount of information in a short space of time. So that is one of the most challenging things about the degree.
Medicine is definitely a challenging degree. Yeah, it challenges you in so many different ways. It touches every aspect of your life. It challenges you first academically. It challenges your discipline. It challenges your emotions. Challenges your spiritual life. Every part of your life. It's a very challenging degree.
So yes, medicine is a challenging degree, I would say, but then at the same time, it is interesting. So I would like to say it is challenging in that it's a journey of mixed emotions, like it's a roller coaster. 1 minute you are happy, like you see yourself as this someone, a doctor who's happily saving lives out there, like educating patients about their conditions, about ways to live, lead healthy lifestyles, and yeah. And then the next minute you're this someone who's sad, someone who feels like letting go, like wants to quit because they feel overwhelmed, like they feel like they can't take it anymore because of the workload the degree has, and then the workload that they have to cover in a short space of time. And then again, they feel like giving up because of the traumatic events they experience in hospitals, like seeing patients die and being diagnosed of conditions like that you'd never wish for 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 anyone, like I would say. Yeah, so I would like to say it is challenging in that way, but then it is interesting then at the same time.
Are good grades important in grade 12?
Yes. Because there's so much competition. Firstly, I think there are many people who, especially people that do science, who want to do medicine, and then also the admission criteria also requires good grades. Because when people apply, you'll find that some people with 8 A's will apply for the same degree. So you want to be able to compete. And there's also a criteria because there's a certain number of people, African people or Black people. There's a certain number of people from the white race, Indian people, that they take, and also depending on the school that you went. But good grades are definitely the beginning metric.
Allow me to use the words extremely important. like I would like to believe that they are extremely important, because there's quite a lot of people who apply for the degree, and then you would find that these institutions, they have a limited number of seats. Like their intakes would be 250 to 300 students at most. So I would like to believe that good grades are extremely important, because they get to put you like in a position where you say, okay, I might stand a chance of being admitted to this institution and stuff. So yeah, they're important.
Good grades are definitely important if you're trying to get into any medical school. But specifically here in South Africa, you need to take the core subjects, which is physics, life sciences, and maths. You want to make sure that you're getting an average of about 75% or above for each of these subjects. But I'm not saying that if you don't get an average of 75% or above, you won't get in. It's just that the higher your grades are, the higher your chances of getting accepted are. I do know that some universities require you to submit a personal report along with your application. Now, this report will include details of your extracurricular activities. So maybe you're a leader at your school, maybe you play some kind of sport, maybe you take part in a choir. All those things are important to mention because it gives the university an idea that you are a well-rounded student. So these are important to mention.
What quality do you think is the most important in a good doctor?
Patience and love. I think you really have to be patient when it comes to patience, because hey, you'll see some interesting things. You have to be also passionate and be empathetic. But I think the one thing, if I could use one word overall, I'd say love. You should have the right intentions. Love your patients.
I think that there are many qualities that are important to have if you want to be a good doctor. One of our consultants would always say that anyone can be a doctor, but not everyone is a good doctor. So taking that into consideration, I think that one of the most important things that can make you stand out from other doctors is how you treat patients and how you make them feel when they're in your consulting rooms. You want to create a space that is free of judgment and a space where the patient feels safe to talk about the issues that they are dealing with or things that are troubling them. Another thing which I think is important is to be up to date with the medical knowledge, because it changes very often. You want to make sure that you're up to date with it so that you can provide the best therapeutic care for your patients, including medications that have fewer side effects or greater efficacies. So if you're up to date with the knowledge, you can know these things and then prescribe the right medication for your patients.
Someone who's caring and someone who's empathetic. Like I believe that if you have those characteristics, or you have such a character, like you would be someone who would treat like patients with the same energy, like regardless of the time of the day, regardless of the patient's economic status and stuff. So yes, I would like to believe that if you're respecting, if you're caring, and then if you're someone who has empathy, yes, you definitely are a good doctor.
Okay, I think to be a good doctor, you need to be a person who's human and who's able to feel emotion and to put themselves in the shoes of the patients or the sick people that you deal with. Because I think the first thing that you need to be a good doctor is to be able to interact with people, empathize with them, and to actually want to help people without not necessarily getting anything in return, you know. So it's just being a humane person, be humane as possible, be able to feel as much as possible, because it requires a lot of passion, you know. It doesn't matter if you are clever or you know the diseases or you know all the information, but I think to become a good doctor, the doctor that you will never forget is the doctor who was able to come down, not necessarily to your level, but the doctor was able to be humble enough to make you feel good, you know, even though you're sick, because you usually deal with sick people. So you need to be a person who's like that.
Why do you want to be a doctor?
This question is quite difficult for me to answer because there are many reasons why I want to be a doctor. But I think the main one is knowing that you're making a change in someone's life, whether you are alleviating discomfort from a blocked nose or surgically removing a tumor. Knowing that you are restoring or improving someone's health is something that I think is rewarding, and one of the reasons why I love medicine so much. I think another reason is that health is such a big aspect of someone's life, to be able to carry on with our daily lives or do the things that we love, we need to be healthy, whether that means being mentally healthy or physically healthy. So to be able to play a role in someone's life in terms of improving health is something that resonates with me.
Grade 9, a dream of mine. I've always wanted to help people. For me, I feel like that's my purpose. It's always been something I've wanted to do since I was young, always just wanting to help people, even though I didn't know how to. And then in actually grade 10, I joined the first aid club, if you call it that. And I just realized, putting bandages on injured players, that feels good to help someone, cleaning up a wound after a soccer match. I was like, okay, that's what I want to do. And that's sort of why I chose medicine.
The main reason why I want to be a doctor is because I've grown to love medicine. So with that love of medicine, I think currently there are two reasons. The first one is the love that I have to actually practice medicine, because it's very fascinating. When you actually study the human body and how it works and how you can kind of heal certain parts of the human body, and the person as a whole, because we are taught to approach a person as a whole, not just the disease that the person has. As I said earlier, you try to be human. So it's just my love for medicine. And then the second reason is I want to be able to have an impact in fighting all the illnesses that we are facing. I've lost quite a few people to oncology, people that I know to cancer. COVID has been around, so when you see things like that, you see that our country or the world at large needs as much help as they can get. So those are my two main reasons. And then my third one would be to make a living, to be able to help my family. Yeah.
I didn't really have a reason to why I want to be a doctor. Yeah, I was that student who say, or a learner, obviously, like back in high school, I was that learner who passes, like who gets good grades. And yes, because he has good grades, he believes it, like he can get into the degree and stuff. And then another reason I didn't have a reason to become a doctor is like back at home, like we lack access to information because of the reasons, certain reasons and stuff. So now, but as soon as I got into medical school, like into the degree, I got to understand more about the dynamics of the degree on the profession, and then that basically gave me reasons to say I want to be a doctor. So I would like to say, okay, to answer your question, I want to be a doctor because I want to be that someone who is in a position of promoting health, like promoting health in that they educate patients or people about health in general, about their conditions, if about their conditions and ways to lead healthy lifestyles, healthy quality lifestyles. And then I obviously want to help those who are sick to get better. Like, yes.
How do you balance your school and personal life?
Thankfully, also with the help of my parents, I did not put any pressure on myself academically. So for me, when I got into medicine, it was already done. Once you're in medicine, for me, it was not important to get 90s and 80s and, push myself beyond myself. I just chose to live an average medical school life in terms of academics. And then I played football on the side. I went into leadership positions. I also did BSc. I finished my BSc degree while doing medicine. So I sort of added more things onto my plate so that I'm not just doing medicine, because medicine alone is quite narrow. You've been quite narrow minded. So they say medicine alone is no longer enough. So always, if I would encourage you, don't just do medicine. Find some other things that you're good at on the side to do.
The main way in which you can create some sort of balance between these two is to plan ahead. Knowing how much time you need to go through your work will help you create that time to do the things that you love and you enjoy. I think it's also important because it gives you an idea of how many hours you need to spend studying a day so that you don't find yourself overwhelmed when the tests start approaching. I think it's also important to take breaks from your academics because you might find yourself getting miserable or feeling burnt out, and you want to avoid this.
I won't lie, it's not easy because, as I said, your first question you asked me how is medicine challenging. Firstly, it demands a lot of time, né? Because you always have to be studying. I think from the word go, one of the things that they try to instill in first year is the workload. There's a huge difference between the workload in matric. If you think that the workload is in matric is a lot, when you get to varsity, it's even more, it's worse. I think with every degree, but with medicine, it's a lot of theory and content, and you have to try and memorize all the stuff, and you have to try and know it. So it demands a lot of your time and discipline. So I try and balance it out by managing my time. I taught myself time management at an early stage. Yeah. So you need to be able to know how many hours you study, and in studying that many hours, it's not necessarily about the number of hours, but it's about how effectively you study during that time. Because you can spend 8 hours studying, but only cover like 2 hours worth of work, for example. So you need to be able to balance that time, and then with your personal life, try and have time for people that you love, have time for doing fun things. Try and make that time, because you need that balance, because once you work too much, you're gonna burn out. So I try and put in the hours, because you have to work. You won't pass if you don't work hard, and try and work smart as well. But also try and make time for, even if it's a video call to a friend or a family member, or if it's to your lover or whoever, but just try and make time for things like that. Go out, 2 hours or 4 hours during the weekend, just do something to freshen up. Yeah.
Planning is the master of all. Like when you plan, I'm one person who likes to structure how they are going to tackle like a certain chapter or a certain block. So I feel like planning on time puts you in the best position to say, well, I'm going to use this amount of time to cover my studies, and then obviously I will have a spare time and stuff. So basically I would say planning.
What do you wish you had known about medicine beforehand?
I guess the one thing that I wish I had known before getting into medical school was that it requires a large amount of discipline and commitment. Getting into medical school, I didn't really know what to expect or how much effort I needed to put into my studies. I didn't even have a proper study method that would help me retain a large amount of information in such a short space of time. So I wish someone had given me a heads up in terms of how much a commitment it is and how much discipline is required to get through the degree.
Not like Grey's Anatomy. Like, what? It's such a mind blow. I was like, what is going on? It's not like Grey's Anatomy. I mean, if everybody watches Grey's Anatomy, you think that's how medicine is, life in medicine. It's not that easy. It is plot twist. And I only found that out in 4th year. And I was like, oh, damn, it's too late to back out now. So, but it's worth it. It's worth it.
I wish I had understood the fact that the people that it's a competition to get in, but once you are in, you're not competing with those people anymore. Those people are your colleagues. Those are the people that are going to help you pass now. So I wish I had understood that better. That just seeing someone studying doesn't mean that I also have to try and study like they do or compete with them per se, but try and work with those people. Secondly, when it comes to medicine, I wish I had understood that it you kind of won't really have a life, if I can put it that way. Not saying that you won't really have a life, but it demands a lot of your time. So it becomes your life. It's like medicine becomes your life, because from the time you're in first year, it demands a lot of your time, but it gets worse as you move up the years, So and when you start practicing, you start internship, it demands even more time, because you can do 24-hour shifts. You can be on call. If you want to specialize, it becomes even worse. So you need to understand. I wish I had actually understood that. Okay, if I'm going to commit myself to this career, it's going to demand all of me and all of my time, because then I think I would have been more prepared mentally. I also wish I had known the importance of mental health, because you can easily lose it. I went into an acute depression in the first year. You can easily become depressed without even noticing it. Anyone in any degree, university, we all need to be aware of the importance of mental health.
Medicine has got it has got too much work. There's quite a lot of work to cover, and then that work is covered in a short space of time. And then I also wish I had someone to tell me that this environment, even though it is interesting at times, it has times where depression gets in. So I wish I had someone to tell me that, okay, now that you want to be you want to get into medical school, you need to develop yourself a coping mechanism, like a mechanism that you will use to deal with pressure, to deal with anxiety, to deal with depression and stuff. Yeah. So I wish I had someone to brief me about those.
What advice can you give to someone who wishes to study medicine?
Say go for it. It's really worthwhile. I also advise you to work hard. I also advise you to balance your life. Don't just study medicine, do other things on the side. And also just question yourself all the time. Ask yourself, why are you doing medicine? That's the best advice I can give you.
Some advice that I would give to someone who wants to study medicine is that I think it's important to remember who you are before you became a medical student. Medicine will form a huge part of your life, definitely, but it shouldn't be all that you are. So I think it's important to not stop doing the things that you love. If you love to paint, continue to paint. If you love to sing, continue to sing. There are different clubs that the universities offer, so I think it's important to continue to do the things that you love and enjoy. I think another important piece of advice is that you need to do this degree for yourself, not for other people, because the degree will push you to limits. It will challenge you in ways that you've never been challenged, and it's always a comforting feeling for me to know that this is what I prayed for and this is what I asked God for. So knowing that comforts me, because I know I'm exactly where I want to be and this is exactly what I want to do, not someone else's decision for me. I think another important piece of advice is to not be afraid to ask for help. Medical students will come from all different high schools and come from being A students, and then you get to varsity, and some of the topics can be really challenging. So I think it becomes difficult to admit that you are struggling with a certain topic, and sometimes people feel that it takes away from your capabilities, and that's not the case. I think that it's smart to be able to identify that you have a problem or you are having some sort of difficulty.
It's someone who's still in high school. So I'd like to say they need to work on getting their good grades to put themselves in a better position of being accepted into medical school. Secondly, that someone has to have a role model. Like I feel like having a role model, someone who's a doctor, maybe someone who's already in the profession, like it would give you, like it would be your everyday motivation to say, okay, I want to be a doctor because one day I want to look like that someone. Like even when you are depressed, like when you feel like giving up and stuff, but because of the reason that you have a role model, someone whom you look up to, like I feel like they could be the reason for you to keep going. Yes. Okay, and then one other thing is you need to have a mentor. Yes, as a medical student, you need to have a mentor, someone who will help you adapt into medical school after high school, because the transition is not so good. Like adapting to this workload, the depressions and etc. is not so cool. But then it is something that one can work on if they have a mentor or something. And again, a mentor comes in handy in situations where they guide you, like in terms of what to study and what not to study, what to expect and what not to expect. So I believe that one needs to also have a mentor.
Okay, if you wish to study medicine, my advice to you would be, firstly, if you're in matric or in any grade, you have to be more disciplined than anyone else next to you. Ne? I think discipline is what sets a person apart. Because if medicine was easy, then anyone that was to would do it. Ne? But you have to try and be unique and use your uniqueness. Work hard. That's the first thing. You have to be a hard worker. Ne? You have to be able to do what other people are not willing to do. Go that extra mile. Put in those hours. Do your best. Work hard. Pray a lot. Okay. I'm a person who believes in prayer. So speak to God a lot, because you're really going to need Him if you want to become a medical doctor. It's a very critical degree, dealing with people's lives. Even during the process of studying it, you have to remain intact until you finish the degree, because you don't want depressed doctors. You don't want doctors that are drug addicts. You want doctors that are going to be able to tell people to not get addicted to drugs without being addicted themselves. So you need to try and keep that balance, and try and enjoy medicine. Try and find love. Studying is not fun, I won't lie, but try and find something that you will love about it. Then there are some things that just fascinate you. And with studying medicine, starting to, like, whenever you need to study a study session, starting is the hardest part. So be the kind of person who starts things. Then everything will just work hard. Have a lot of hope.
What do you have to say to someone who is not accepted to medical school?
All I can say is keep your head up, and I hope that you'd have a good support system from your family. I mean, there's always that pressure to get a degree and start working and start supporting your family. And if that pressure is just not right and not acceptable. So from my side, I was lucky to have a family that just said, keep on trying for medicine because that's what you want. If it is what you want, don't give up. There's so many ways you can get into medicine via BSc. You can do it via the GEM program. There's so many ways. So don't give up.
I think that the most important thing to keep in mind is that this is not the end of the road. Not getting into medical school on your first try doesn't take away from your capabilities. You shouldn't allow it to create doubt in your mind about how capable you are. And most importantly, if this is something that you really want, you shouldn't allow it to stop you from reaching your goals. One of the options that you do have is to rewrite your matric exams. This will allow you to improve the subjects that you didn't do so well in, and it'll give you that year to kind of figure out whether medicine is really something that you want to do or not. Another option which you could consider is studying another degree which is still within the health science faculty. This could be pharmacy, medical science, optometry. There are really a wide range of degrees within the health science faculty, and it's not just medicine. So by doing so, you can then apply for an internal transfer within your university, or you can apply to another university. I'm not saying that this guarantees you acceptance, because some people will end up finishing that degree before getting into medical school. But the advantage is that some of the modules that you cover in that degree will also be covered in the medicine degree. So that means that you'll be credited for some of these and you won't have to repeat them.
Go do other medically related degrees like your Bachelor of Sciences, your pharmacy, your Bachelor of Nursing and stuff. And then they need to excel in those degrees, like pass with flying colors if they still want to be considered for this degree, I guess. So I can say they need to go do those degrees, excel in those degrees, and then they might be accepted into the degree.
I know a lot of people wanted to do medicine but did not get in. Because if you really love medicine, if it's a passion, don't give up. Yeah. So the first thing, if you were, I know a lady recently who didn't get enough grades, if I can put it that way, or enough points to be accepted. But because she was so determined to do medicine, she went back to grade 11 and she said that she wanted to start from grade 11, do matric, and try and get better grades. But even if you're not willing to do that, to go to those extremities, you can start by doing another health science degree. Okay. Then I know postgrads, a lot of postgrads that are very good medical students, by the way. Postgrads are very good because they're experienced in studying, and some of the material that we study, they already know it, especially in first and second year. If you don't get accepted, sorry, don't be dismayed. Okay. There are many routes that can end you up in a degree of being a doctor. I know a doctor who started with a biochemistry degree in UniZulu. Then he applied here, at medical school, and now he's a very good doctor. Just if you really want to do medicine, you will do it. But there are many ways. Just don't give up.
I have a lot of favorite moments from this entire video, but my one takeout was to never give up. I think this applies in all aspects of life, and I hope it's something that you can take with you, to never give up, to keep trying, and to work towards what you love. That's it from this video. Please like this video and please make sure you are subscribed to my channel. Bye.